All right, Carlos, think you can take it away.
Perfect. So, hello everyone. Welcome to the Come to Believe Network's latest panel discussion, a Cure for Health Disparities, the Importance of Diversity in the Medical Field. My name is Carlos Martinez, and I am one of the communications manager at Come to Believe. Um, I'll be honest, I just had a cramp on my leg. If it happens again, I apologize. I worked out earlier, my body is a mess. But it is a pleasure for me to be here with you all today, and just to have a really interesting and important discussion. And let's go over our time together this morning. So I will do a brief introduction of our panelists, then we'll have a research presentation about workforce diversity in the health profession, followed by a roundtable discussion. Finally, we will have time for audience Q&A. If you have any questions that come up at any point during the panel, use the Q&A feature and we'll take a look at them and answer them at the end. Um, for those of for those of you joining us for the very first time, Come to Believe, the Come to Believe Network, CTB, was formed to provide higher education institutions with an innovative, results-oriented two-year college model that is accessible to students who are underrepresented at selective universities. I am a product of that, and I am super excited to be here. Our model provides both a credential and a pathway to a bachelor's degree, a better normal in a way for higher education, for a higher ed access. The CTV model is designed to serve a diverse population of students at both Arupa College in Chicago and at the Doherty Family College in Minneapolis. We have over 90% of students that are students of color. And as a result, one benefit of these colleges is the creation of a diverse talent pipeline for a variety of professional fields. This is especially true in the health profession, which is the topic of today's panel. As just one example that we have, it is a pipeline of this pipeline in action. It is Arupa College recently launching a nursing wave program within Marcella Neoff School of Nursing at Loyola University in Chicago, which again, it provides access for these students to get into the medical and the healthcare profession. Now we will hear more about the program during the panel, but first, let me introduce the amazing panelists that we have with us this morning. So we'll begin with the panel with a research presentation by Dr. Kirsten Wilbur, who is a clinical associate professor in occupational therapy at the University of Puget Sound. We are also joined by five expert panelists. Martha Alonso Johnson is a clinical faculty member in biology at DFC, Doherty Family College, within the University of St. Thomas. We have Esther Gersimi. She is the legislative correspondent with a health and judiciary portfolio for Senator Tina Smith of Minnesota, as well as an alum of Aruba College and my former classmate. We're also joined by Vicky Teo and Lee Schmidt of Loyola University Chicago. Vicky is a professor emerita of nursing and Lee is an associate professor, executive associate dean for academic affairs, and an assistant dean for the PhD in nursing program. And finally, we have Denise Marte. She is the chief resident in emergency medicine at New York Presbyterian Columbia Cornell. We are looking forward to a great discussion, and with that, I will turn it over to Dr. Wilbur for the research presentation.
All right, well, thank you. I'm going to try and share the screen here. There we go. Can everybody see that okay? And you can hear me okay. All right. All right, well, I really want to thank Come to Believe Network. It was interesting finding out about your initiatives and programs there in Chicago and Minnesota. And I appreciate the opportunity to discuss the research article that we're looking at today, along with my own research. Since the article that was co-authored with a researcher from the University of Washington School of Medicine, along with instructors from a physician's assistant program in Arizona, I am showing the labor and statistics graphic here for percentage of individuals in the workforce for physician assistants and occupational therapists. And this graphic really demonstrates how white both of these professions are. And I have to say, if you go to the Bureau of Labor and Statistics website, you'll see that these numbers are fairly consistent across the allied health workforce. So physical therapy, nursing, speech therapy. And I've been looking at these numbers since around 2015, and they've stayed relatively the same. We've seen slight increases overall in the number of healthcare workers of color. However, you can see from the graphic that it is still predominantly a white labor force. There's practical reasons for looking at increasing the medical workforce diversity. One is that it advances cultural responsiveness, and I use that term versus cultural competency just because I think our efforts to be culturally sensitive, it's an ongoing process. And then it is also important that we increase access to high quality healthcare for everybody and strengthen the medical research agenda so that we're doing more study around individuals of color and health outcomes, and then ensuring optimal management of the healthcare system. There's abundant data that exists in documenting that Black, Hispanic, and Native American physicians are much more likely than white physicians to practice in underserved communities and to treat larger numbers of minority patients, irrespective of income. We also find that Black and Hispanic physicians, as well as women, are more likely to provide care to the poor and those on Medicaid. And as well, there are true consequences for the lack of diversity within the healthcare profession. We find that people of color and low socioeconomic status populations end up shouldering the burden of illness-related morbidity and mortality, and racial and ethnic health disparities end up costing our nation billions in excess medical expenditures. Additionally, we need to address bias among healthcare professionals. Greater mistrust in the healthcare system and experiences of bias in medical encounters can reduce the use of healthcare services and erode confidence in the prescribed medical regimen, leading to lower levels of medical adherence, less utilization of preventative services, and ultimately poor health. The term concordance means in agreement with. So we find that patients with healthcare practitioners of the same race report greater respect compared to patients with a healthcare practitioner of a different race. Racial, ethnic, and gender concordance is not exclusively the result of physician practice location. However, it also appears to be the result of patient choice. The bottom line is that we know from the literature that racial concordance is important for improved patient health outcomes. And when patients see healthcare providers who look like them, there are better health outcomes. We also know from the literature that bias among healthcare providers exists, and the more diverse our workforce, the better able we are to address bias among healthcare providers. So now I'll be transitioning into some of the challenges for health professions education programs, and then going into what led to my research. So this graphic is an indicator that the pool of high school graduates is expected to become less white, more Hispanic, Asian Pacific Islander, and increasingly located in the South over the coming years. So we might think that that's good news for the health professions because of the increasing diversity in our country. This project report from Higher Ed also indicated that Hispanic graduates will be spiking by 50% in the public high schools. Asian and Pacific Islander graduates are projected to spike by 30%. Black public high school graduates are expected to level off and decline slightly, and white public high school graduates are projected to fall by 14% between 2013 and 2030. The population of white public high school graduates is projected to decline by about 250,000 people between 2013 and 2032. And we know that higher ed is dealing with some of the repercussions of this with low enrollment numbers and looking to make cuts in faculty, staff, and programs. If we look at the field of occupational therapy, this is the most recent report from my professional organization, and we can see that students that are currently were enrolled in the years between 20 and 2021, the numbers show again that predominantly it's white students who are enrolling. If you look at the bottom line for the occupational therapy assistant, those programs tend to take place in our technical and community colleges, and they're about an 18-month program, and they do tend to attract a greater diversity of students. However, they're still predominantly white, and they offer an associate degree. This graphic shows the percent enrolled who identify as Hispanic. And then this slide was a comparison that my professional organization did to show the differences between the years of 2010 and 2021. And so we see that there are in some cases, slight increases in diversity. However, we've lost ground with American Indian, Alaska Native, and Native Hawaiian and Pacific Islander. This also shows that, again, it's the occupational therapy assistant programs that tend to be more diverse of our programs. And this would also support research that came out of the University of Washington School of Medicine, where they found that a majority of people of color in the healthcare workforce end up in entry-level or lower paying jobs with little opportunity to advance. And this would include such professions as nurses' aides, occupational therapy assistants, physical therapy assistants, and technicians. So my research looked at kind of addressing this issue of the pipeline, the problem of the pipeline from high school into post-secondary programs. I ended up in an urban high school here in Tacoma, Washington, in 2 college-bound classrooms. I ended up including 6 students who met the criteria between the ages of 15 and 18 years old. 3 students identified as Black, 1 identified as white, 1 student identified as multiracial, and then the only male student in the study identified as Asian. I also reached out to the high school guidance counselors. There are 4 of them that were on staff. 1 agreed to participate, and she identified as female, 26-year-old Black Hispanic. I used a critical ethnographic study. I spent the first 4 weeks of the spring semester observing the classroom and then began individual interviews. I also conducted 2 focus group interviews using semi-structured and open-ended questions. The purpose of my study was to better understand how students of color make career choices and what might influence a choice of occupational therapy as a career. The categories that represented student experiences in making those decisions were no interest in healthcare, navigating the system, and making choices. Study participants indicated that their interest in science and math diminished after middle school, and for some, math was a subject that they had enjoyed. However, once they got into the high school requirements for math and science, they found that they were less interested in them, and in some cases discouraged to continue. And for many of these students, they perceived that a strong performance in math and science was necessary in order to pursue a career in healthcare. 2 of the 6 students reported knowledge of the profession of occupational therapy. And of those 2, one had received occupational therapy as a child, and the other student had a relative that was in a skilled nursing facility receiving occupational therapy and physical therapy. Again, 4 of the 6 students reported that their career choices were influenced by how they were performing in their high school courses, and 4 of the 6 students reported not liking science and math classes that they were required to take in high school, even though for all 4 of these individuals, they had performed very well in math and science in the middle school. My colleagues that I co-authored the paper with came up with some recommendations to help kind of assist a greater pipeline for students of color into the health professions. We would recommend that they establish and monitor partnerships with the community colleges, the four-year universities, and health profession programs to develop pathway programs for students who identify as racial or ethnic minorities. And it sounds like the Come to Believe Network is acting on those recommendations. And then we would recommend that there be the ability to identify, develop, and evaluate strategies to reduce financial barriers in education and training processes in the healthcare professions for students of color. The financial costs have significantly increased for students, especially in the four-year college. And many of the, the assistant programs tend to be more in the tech and community college level, and that makes them a bit cheaper. So that might be why perhaps there's a greater interest. But it does become a barrier when a student has to consider a four-year degree. And then now, because physical therapy, occupational therapy have moved into clinical doctorate degrees, they have to complete 4 years at a university or college and then apply to graduate school. We also recommend to identify promising infrastructures that support academically and develop professionally students towards a career in the health professions programs, and then develop professional pathways for those who are in entry-level health professions to advance their careers. So examples of that would be maybe bridge programs from the assistant professions into the clinical master's or doctorate degrees. And then finally, we need to explore the impact of recruiting and hiring diverse faculty in higher education, because as my study and other studies have shown, when students see themselves in these places, they are much more likely to, one, apply to the program and also to succeed. And that concludes it. Thank you.
Well, thank you so much, Dr. Wilbert. I personally really appreciated reading and now listening about this research just because of my personal experience, especially being Mexican, having a single mother who had to deal with all these struggles within the healthcare system. I truly, really appreciate how thorough and how, you're looking at it from a very holistic point of view. So I truly appreciate it. But now I do have a question for all of you here. How does Dr. Wilber's research align with your personal and or professional experience? Does anyone want to tell us what resonates with y'all? Maybe we can start with you, Martha, if that's okay.
Sure. I think that when Kristen said about, oh, science is just not for me, or I'm not that good at science, I hear that so often at the beginning of my class. When I have these students and I honestly ask them, how was your high school science experience? And a lot of them did not have a positive high school science experience. And here at DFC, they have to take, it's a general requirement to take human biology. And they already feel like they're not going to be good without even going through the process. And so that's one of the things that that I'm trying to um, take a different path on, to try to make them be, or at least open them up to there are different ways of approaching science. There are ways that you're bringing your own knowledge that you probably already have into this classroom. And I'm trying to get them to explore topics that are of interest to them, so they can see how science, especially, human biology, is connected to them because they are humans.
So is it okay if I just make a couple points here? So I just wanted to add to that. So thank you, Dr. Wilbur, for your presentation. And so many of the points you made, I'm a nurse, and so I'm going to bring the nursing perspective here. But, one of the points you made is about the faculty. So important that the faculty is considering how to touch people that are not excited about science or don't really feel like the science is for them, but yet, as you pointed out, they do well in science, but somebody didn't light that spark. And we found that too. And I know Dr. Lee is going to talk a little bit more about the struggles in nursing, but when we did our program with the Roubaix College, one of the biggest hurdles that we had to cross was how to strengthen their science background, because exactly what you said was that they were not performing well in science. And of course, in the healthcare professions, it's a science background, right? If you don't understand your science, I always say that we're scientists first, and then, we develop all the other skills around healthcare. But I truly appreciate that point.
If I could also add, I resonated, like all of your points resonated with my experience, Dr. Wilbur, going through medical school and now residency. But I feel like one of the areas that we don't talk enough about is how do we help support students in their like self-sufficiency financial goals? Because on top of tuition, books, fees, many times there's so many competing interests that even your family members who want to see you, be the first physical therapist in the family or whatever your dream may be, they don't really know how to support you with just cash in hand while you are in school for an endless amount of years, is what it feels like. And so, I remember on top of trying to apply for scholarships and make sure I was getting free books online and not buying things. And also, collecting mentors like they were Pokemon so that I had people to support me. I also really, really struggled with, balancing my time and making sure I was doing those odd jobs and babysitting on the side and working at Starbucks and working at McDonald's when I needed to, just to make sure that I wasn't burdening my own family, because it was an experience that they just didn't really know how to support me with. And that one is a huge, huge reason why students end up, I feel, leaving careers in the health professions, because they feel like at a certain point, I just have to get a job. And I think it's something that we should all pay a little bit more attention to.
Victor, I guess I would add 2 points. One, I appreciate seeing your recommendations at the end, because I feel like the program that we developed in concert with the Roubaix College really addressed those. So I felt like, okay, this is some validation that we were on the right track. The other thing, I just want to go back to the science. I know in nursing we had this myth that your science GPA was something that we should consider for admission. And before we went test optional, we looked at the science ACT score. We actually looked at some data about successes within the nursing program, and we found out that the ACT score in reading was more important than the ACT scores in science, which intuitively makes sense. If you're struggling with reading the textbook, you probably are going to have struggled from the grade perspective. But that was the way we sort of dispelled one of those myths that the science GPA was the be all end all for admission. So I think that was very helpful too.
And I think one of the other points I want to make is that what a Roubaix College does that is so important. And Dr. Wilbur, you touched on some of these points when you talked about what can we do. to affect increased diversity in the healthcare professions. But we actually, Arupe takes in our program a 4-pronged approach, which was not just financial, which is, of course, if you don't have the finances, right away you're out, right? So that's, and the other piece is the academics. So there's such great support for academics. But the two other areas that research has shown is so important and contribute to the success is emotional and social. Yeah. Because if there's not the emotional support that they need, you can do this. You've got the skills, you know, this support to just convince these people that they can be successful, but also the social support, right? There's a lot of students that are taking on huge social burdens in order to be successful. So there's this 4-pronged approach of finance, social support, emotional support, and academic support that really just made the program so successful. And I think you brought a lot of that up in your research.
Yeah.
Thank you.
I just wanted to comment about the science and math. I mean, that really struck out to me that, I mean, all these students had an interest in it, especially in middle school, but something happens in high school that squashes their interest. And the other myth out there is that you have to be strong in science and or math to go into healthcare. And I was not strong in math. I had a high interest in science, but both were kind of, you know, challenging for me. But I think, you know, things like physical therapy, occupational therapy, speech therapy, nursing, it's not that you have to be that strong in those areas, but the students don't understand that. And so they're, you know, they start, you know, and they get these career tests in middle school and high school that start to send them on these pathways. And I think if they at that time acknowledge that they don't have the strength in certain areas, then they're not going to end up, I guess, falling in those healthcare paths. The other good news around the financial literacy that I saw in this college-bound program, and I don't know if this was unusual, but the college-bound instructor was phenomenal. She met with these students on the weekend. They had her cell phone. They could call her. She helped them fill out their FAFSA. The guidance counselor in this high school also made sure that they understood that they could qualify for 4 years of paid college tuition through certain grant monies. And they really tried to work with this particular group of students to tie into those financial programs.
Thank you all so much for sharing. Esther, I wanted to get your thoughts.
Thank you. I was going to add one more point. I just want to say thank you so much, Dr. Wilbur, for your research on this. One thing I was going to talk about was experiences with, you know, healthcare practitioners when they're not from your cultural background. I personally have struggled a lot with just communicating my health concerns to my healthcare provider due to them just not really understanding you know, my like history, or also like where I'm coming from as a Black woman. I feel like having one healthcare practitioner who is of the opposite gender and then them also being a different race really plays a huge role, because they kind of tend to attack a lot of healthcare concerns from the perspective of just like, you are a woman, not necessarily you are a Black woman. So that's something that I think needs huge work. And, you know, we've talked about these things even in healthcare meetings at my office, but there's so much more work that could be done.
Esther, thank you so much for sharing about the intersectionality of our identities when it comes to the way healthcare works, right? And thank you all again for sharing your thoughts. But now let's shift into the roundtable discussion. I would like to ask a specific question to some of you, but if anything comes up, feel free to share your thoughts as well. But Denise, I wanted to ask you, from the practitioner perspective, what are the benefits to having medical professionals with backgrounds that reflect the communities they serve? What are the drawbacks when this representation is lacking?
Thank you for the question. So I work in the ER, and everybody comes to the ER on their worst day, and everyone comes to the ER with the story that, my friend from down the street went to the hospital once and something really bad happened to them. And that could very well be true. So I'm dealing with that. Every single patient that comes in the door really demands my ears and my compassion. It's really hard to do that when you are busy. There's an incredible volume of patients, and when you really just don't know where a patient is coming from. So I was born and raised in the Bronx, and right now I work across the river from. I actually work in the hospital I was born in, but I know every crevice of the community that I work in, and that's very rare. It's rare for anybody, let alone a person of color working in medicine, because many times we often flock to where there's more mentorship, but not necessarily where we necessarily grew up. But it's huge for people. Like I hear the sighs of relief multiple times a day when I'm at work. That someone's like, "Oh my God, like you're my doctor." So I'm from a Dominican background. This is an area that has a lot of Dominican patients. They'll be like, "Oh my God, a Dominican." And so those patients are more likely to tell me, what are all the things you've tried at home? It's actually very common in my culture for people to try antibiotics from a friend or to get them from the DR and like have some at home. And many times they don't want to tell you, I've been having these UTI symptoms for a week and I took antibiotics for 5 days. And that, as a doctor, should raise my flags for, does this person have a resistant UTI? Do they need IV antibiotics? Do they need to get admitted to the hospital? But if I'm not really getting that context because a patient, for whatever reason, feels embarrassed to say that or that I'm not going to understand, as a provider, I really can't do my best work. Another example I'll give you guys is in certain cultures, people tend to use hair relaxers to straighten curly hair, right? Hair relaxers contain a chemical called lye that can actually, if left too long, be corrosive on the skin and can cause like burns, scalp burns. Those are very, very common, especially for people who do relaxers at home, which lots of parents do with their young kids. My parents used to relax my hair when I was little. So I'm vividly aware of what is sometimes a normal reaction to this kind of treatment. However, where I went to medical school, a parent got Child Protective Services called on them because they brought their kid in for a scalp burn after using a relaxer. And that's a big deal. It is a big deal to involve that kind of apparatus in a patient's family, in their home. Are there other kids? Will there be other repercussions? And oftentimes it falls on Black and brown people to have, this increased burden of Child Protective Services calls from providers' offices. But those are the little ways in which it's really important to know the cultures of your patients. And, again, I see it every single day, the sighs of relief and people really like hoping to open up. But I can see where it's very difficult to do. I also take care of patients from cultures that I share zero identities with. And when I work downtown and I'm taking care of a lot of patients, for example, from rural areas of China who live in very like thick Asian communities here in the city, I have no idea what their systems of care look like. And those are times that really demand my energy, my attention, my understanding, asking more questions, how are you going to get cared for at home, or what have you been trying, etc. But in a busy ER, it's really easy to just focus on seeing volume and, doing the bare minimum to get by. But it's really, really important to have the cultural context. And I truly wish every patient in the US had access to a culturally appropriate healthcare provider. And unfortunately, I think the severity of the disparities we see in this country are a direct result of that not being the case.
Denise, thank you so much for doing the work. It does sound incredibly difficult and challenging to continue learning and relearning a lot of things, but you're doing it, and I'm sure your community truly appreciates the work that you do, and we do here in CCD as well. But now I wanted to ask you, Esther, when zooming out to think about this from a national policy perspective, why is diversity within the healthcare profession something that policymakers should be paying attention to?
I would just like to start with it's the right thing to do. It's the right thing to do. Everyone, deserves equal opportunity to like these types of positions. And, people from different backgrounds have different perspectives, which in general would just make the whole field better by welcoming different perspectives. From the perspective of patients, I feel like, there's a lot of data that, shows that if you have a provider that understands or is from the same background as you would just get better care because they understand specifically what you're discussing. Kind of like how Dr. Denise mentioned with her, having a connection with the hospital she works in and patients that she deals with. Another thing is just kind of viewing it from the economic perspective. I feel like if people are getting better care, especially preventative care, that saves money in the long run. Because if you are able to get, checkups often and not just the regular annual checkup where you go in and they actually barely do an examination and just tell you everything's okay, you wouldn't like have, issues or concerning health issues down the line because you're already able to attack that earlier when you go in for these checkups. Maybe it's like once every 3 months to talk to your practitioner, and better for patients and also better for the economy. And these are things that unfortunately, it's not the reality, most especially for people from underrepresented communities, which is why I feel like just kind of having talks like this, having panels like this to discuss the problem and how we could attack it would really be great for everyone and just the betterness of the country. So I really appreciate Dr. Wilbur, doing a lot of research on this. And also policymakers should not just, I feel like a thing about working in the Senate is kind of like how there is a divide between Democrats and Republicans. And I feel like if people could just put their egos and pride aside to attack these situations and view it from the aspect of these are affecting people's daily lifestyle, then we could actually do something about it rather than just kind of voting in a specific way because this is how my party has historically voted. That's another problem. So, but yeah, I'll just keep it short with that.
So thank you so much. And in a way, you're shining the light into a bigger issue, right? That it just goes beyond just the healthcare professionals, the higher education leaders, but everyone that is involved in our country and in the work that goes on every day. So thank you for that. Now, going back into the higher education, perspective, I want to ask you, Martha, what does higher ed play? What role does higher ed play when addressing the issue? How does this connect to you and your colleagues at the Doherty Family College?
Yeah, when I'm thinking about higher ed and when I'm thinking about like students who want to go into biology or want to go in the pre-med track, we always hear the stories of the weed out classes and how you have to survive that, right? And I think we need to change that. We need to be more supportive in our students and create those supports instead of just letting them fall because we're trying to weed them out. And one of the things that we're doing here at the Doherty Family College is creating those supports. And I feel like Arupa is doing something similar, like we're doing similar things in supporting our students. So one thing that we do is even though like they come from various science backgrounds. Some of them may have had a lot of science in high school. Some of them, this year, for example, they don't really remember their biology class because it happened to start during the pandemic. And so for a lot of them this year, it was about kind of teaching something brand new to them that they may not have known. Um, but in that, supporting them on this journey of learning something new, and supporting them in different ways. We do through tutoring. Our classes are a little bit longer, so I try to spend some more time in small groups with them, and creating kind of that scaffolding in our syllabus, in our teaching, so that we build on things and then we repeat and show them. So I would say for higher education, increasing those supports and changing it from like, oh, let's see who falls out, to let's see how we could support everyone and lift everyone up.
Wouldn't it be amazing to just be able to, use a magic wand and make these supports appear at every institution? I think, Esther, who do we talk to? Can No, but in all seriousness, it is amazing the work that you as a faculty member and all faculty members and staff members at institutions, higher ed institutions do in order to really be there for the students throughout the whole process. So thank you for sharing that with us, Professor Johnson. Now, Dr. Wilbur, I want to ask you, how has your research in this domain influenced your work as a faculty member working with students?
I think the main influence is, from my research, I gained a greater awareness of the struggles that some of our students of color go through. And then based on that, I was able to work with my colleagues in the department to think about ways we could diversify our student cohorts, and also think about diversifying our faculty. And I kind of see it as a three-pronged stool too, because then once you have that diversity, we need to be sure that we're teaching and using inclusive practices. And it takes time. From the time that I did my research over the years, we saw some improvements, but not great ones, I would say. But in the classroom, I think it really maybe showed up for me, just thinking about the life experiences that our students can bring to the discussions. And I'm fortunate enough to teach a unit on social and cultural awareness, which is probably my most favorite course to teach. And then how that makes us more culturally responsive healthcare practitioners. But with that course, I'm able to kind of do more discussion-based work, and then assess learning using a variety of methods so that they can bring their creativity and their talents to the semester end project. So they'll do things like bring in a dish of food that has significance for them, or someone explored their Chinese background and Chinese herbal medicine. Another individual I remember looked at the healthcare disparities for Native and Indigenous women. So they bring those kinds of things, and it's really, I learn from it, and they share it with their other peers in the classroom, and that's nice. The other thing that we instituted in the last couple of years was an equity team, and so we had a faculty representative from our tenure line and our clinic line, and then a student of color from each of the cohorts. We have 2-year cohorts, and a member from the staff. And it was just an opportunity to think about, well, what are the needs of the program? And then what can we do to move along with that? And the first topic that came up is, in many of the courses, students are being evaluated on their professional behaviors, but those can, I guess, marginalize a lot of our students of color who have extenuating circumstances, those social circumstances that were mentioned earlier, that I think a lot of the white faculty might not be sensitive to. So that was kind of a nice thing to look at and it helped us reconfigure our assessment in each of the courses of, student performance. Unfortunately, when you're in a professional clinical program, we have academic standards that our accrediting body holds us to. And so that drives some of what happens in the classroom. So we've had some interesting conversations around that too, as to how those academic standards are somewhat biased and not friendly towards our minoritized students. So those are just a few of the ways, I think.
And those are really, challenging ways to move forward, but you're doing the work. And for me, it just makes me feel hopeful about the future, right? About how things are progressing and changing. So thank you again for doing all that work. Now I wanted to ask you, Vicki, Lee, the Aruba College Marcella Neoff Nursing Pathway Program at Loyola Chicago was assigned as one of the solutions to this really big problem as we're listening now. Can you tell us a bit more about the genesis of the program and what it aims to accomplish? We can start with you, Vicki, if you'd like.
Yeah, so if it would be all right with you, I'll just give a 2-minute overview of what's going on with nursing. And then I was the dean of the School of Nursing at the time that Aruba College came into existence. So I was part of the leadership team at Loyola that embraced that and made sure that that program moved forward and got all the approvals, which was the first ever in the history of Loyola University to have a 2-year college subsumed under the university. So it was an exciting time to be there. And as dean of nursing at the time, it was excited to be a part of that. And I'm going to let Dr. Lee Schmidt talk about how we did that, because he did it with me, and it was really a joint effort. And as the executive dean, associate dean of academics, it was really up to him to put together the program that would be successful. But before I turn it over to Dr. Schmidt, I just want to make a little plug for the nursing profession, because I know, Dr. Wilbur, you talked about the other professions besides occupational therapy, and you were exactly right when you said we're very similar in the way we look in nursing. We're about 80% Caucasian. But what I wanted to impress about nursing is that nurses are the largest healthcare profession in the United States, and we make up about 4.2 million healthcare workers, and also, after physicians, one of the highest paid. So it's enticing to bring minority students and students of color, because there is no end to your success. You could come in with an associate degree, a bachelor's degree, a master's degree, or a doctorate. I mean, there is no limit to how far you can go or where you can start in your nursing career. But we need to move those numbers. And the reality is that in the next 10 years, we're going to face one of the largest nursing shortages in our nation. And as Dr. Mark talked about, it is so important that people are treated or touched by professions of their own race, of their own color. And when you talked, Dr. Mart, I so appreciate your point about the lie burn, because as you were telling that story, I'm thinking to myself, how much did that enhance the mistrust of healthcare, right? And all it took was someone like you, or maybe I've even a nurse in that field that said, wait a minute, stop this train right now, because this is the cause. But so if you could imagine that in every hospital and every clinic across the nation, we had increased our nurses of color, that we could touch so many, how much more we would gain in terms of patient outcomes. We know patient morbidity and mortality goes down when we introduce culture. We know that patient outcomes are better. We know that they have more trust. So with that in mind, we did work with Father Katsouris, who was the founder of the Aruba College at Loyola, because Dr. Schmidt and I both agreed and knew that this was an important part that the School of Nursing had to be a part of. And so with that, I'd like to turn it over to Dr. Schmidt, because he really was the brains behind this, and he was the academician that put it all together. So Dr. Schmidt, can you tell us about how you built this program?
Sure. Thanks for that, Vicki. The Aruba started in 2015, and what we heard early on from the leadership there was there's a lot of interest in health professions. So we had that initial meeting, which I think, you always have to have the initial meeting. And I think we all came to agreement there that let's make sure that Arupe can work through the growing pains of starting a new program. So we agreed that we weren't going to like do this health professions track right away or the nursing track right away. But once they got through their first cycle of graduating students and did some quality improvements in terms of what worked, what didn't work, where do we need to beef things up, we met again, and our initial idea was, let's not make this a associate degree and then transfer to a baccalaureate program, because we're all under the same umbrella. Let's make this a pathway program. So our nursing program at Loyola Student Center as freshmen, they start taking their nursing courses right away. But around the same time, we also brought our science courses into the School of Nursing. So we hired instructors to teach anatomy, physiology, chemistry, and microbiology. And we could put that health science and health professions spin on those courses. So it was very easy for us to take the Arupe program and see, well, where can we start to have those students actually start taking their science courses with our freshman students right away. So the students do their first year at Arupe, and they're getting their AA degree. And Arupe goes year round. Our program is only fall and spring, but then we worked out how we could put our programs together so that the freshman year, when the students are taking anatomy, physiology, and chemistry, they could also be finishing their studies at Arupe. So that first year in the BSN program as a freshman is really the second year of completing the Arupe college degree. And then the students transition right into the sophomore, junior, and senior years. So it's really a 5-year associate degree and Bachelor of Science in Nursing program. So that's what I think was really unique about this, is that it was truly a pathway program, and it wasn't finish your AA and then apply to an upper division program. Our initial plan was to start small, so we started with 3 students. They go through a really abbreviated application and did interviews, and we had great interest the first year. And then, of course, the pandemic hit, so things went awry. But at the same time, we were able to get some government funding through a HRSA grant to actually expand this pathway. So we have something called the CARE pathway now, which stands for Collaboration, Access, Resources, and Equity. And we're putting in a lot of those supports that Arupe has, like the intensive peer, faculty, alumni mentoring, intensive academic supports. We were also able to get some funding from the Hearst Foundation to put in some tutorials with our science courses, just to make sure that we're giving a good foundation. And the nice thing is that those are available to all the students in the program. The CARE pathway was meant to expand the number of Arupe students, but we've actually been able to expand that to include other students of color who are in the 4-year program. So that's a 4-year grant that's running, and we're in year 2 of that right now. And we put in the peer mentoring, the alumni mentoring, the faculty mentoring. We're working on some additional academic supports. We've been fortunate. This program has been very attractive to donors. So we were able to get some donors that's basically are covering the full tuition for those initial 3 students in the program. And I'm very happy to say it was attractive to a major donor. The Sisters of the Resurrection have endowed us with a $4 million grant to continue this Success Center once our funding from HRSA runs out. So that's a legacy for the Sisters of the Resurrection, but it will allow us to continue with these academic supports. We're still going to have to figure out how we can get the financial part of it, but I think we're on the right track in terms of making this a program that puts supports in place so students can be successful. We're also, as part of this, we're going through a holistic admissions process, so we aren't going to rely on the admissions office doing our admissions anymore. We'll actually bring the admissions part into the School of Nursing and focus on things more than just GPA and things like that. So I think overall the program, what started out as an idea, actually has blossomed into something that I think has real impacts for diversifying our student body at Loyola.
And also the future of the healthcare system. in our entire country. So that is super exciting to me for me to hear. When I was a student at Aruba, I kept hearing about the workings that were happening to make this a reality, and it's happening. So again, it's super exciting to hear, and thank you both, Vicky and Dr. Lee, for sharing with us. Now, Denise, addressing this issue isn't just about access. How does the structure of and content of the medical education exacerbate this problem?
Yeah, thank you for your question. I was thinking about this a bit when I got the first list of questions. But so there, I want to go back to this concept of like faculty being a big issue because that's really the bottleneck in the pipeline, in my opinion. Uh, you can't learn things that educators are not prepared to teach. And so there are a lot of old adages in medicine, probably nursing as well, where, Black people don't feel pain as much. They have higher pain tolerance. Black skin is thicker. Black kidneys don't or aren't supposed to work as well as white kidneys, and therefore higher kidney numbers shouldn't clue you into potential kidney damage. Or Hispanic patients don't care about managing their long-term health problems as much. So, don't talk to them ad nauseum about the importance of taking their diabetes medications because they just don't care. Like these are things that you learn sometimes directly in medical school, but oftentimes you learn it indirectly through interactions with people who are there to train you on how to be, a good physician. And so it's really mixed messaging to say, hey, we want the most diverse healthcare workforce and we're here to support you. But then you work with a provider who, truly believes these things and thinks that teaching you pearls such as, people of color don't feel as much pain as white people. They think it's there to help you be a better doctor. And oftentimes those are things that necessitate can we break this down? Can we talk about this conversation that many faculty are just not prepared to have? So in my experience in medical school, a lot of us at the time really demanded a systematic and strategic approach to learning about health disparities that went through all 4 years of medical school. And the faculty at my school truly were not ready to teach that curriculum. And so they had to, over the course of years and a lot of student activism, they had to really decide to dedicate the time, resources, and attention to educating the faculty on how do I become, an anti-racist instructor, or how do I talk about health disparities in a way that's not pejorative and minimizes the very real, harms and damages that people feel. How do I help support a student when they're bringing up, some family context or some historical, some social or cultural context that they know that other people in the room might not know. For example, talking about the effects of extreme poverty and having to move all the time and what that does to your ability to control your blood pressure and your diabetes and get medications, et cetera. And so I really think that there are 1,000 paper cuts in the health professions when it comes to actually being at the point where you are getting that one-on-one training to be someone's doctor, nurse, physical therapist, occupational therapist at some point, and trying yourself not to learn racist medicine is really hard. And so I wish there were more faculty of color, but I think there are students around the U.S. really demanding this introspection and really consideration of the pedagogy of how we even talk about health disparities in the health professions. Um, and it needs more time and attention. But I think it's yet another barrier on top of the things that we've all been mentioning already. but I'm hopeful. I don't want to put it on a negative spin. I'm very hopeful. I think people are, like, the American Medical Association has a huge, sorry, the Association of Medical Colleges has a huge consortium of schools that are really just sharing best practices, sharing curricula, sharing materials. Like, we shouldn't always be reinventing the wheel. And if we know what works, we should be able to take the bare bones of what works and really apply it and reapply it in schools all over the country, because the messages are important all over the country.
Definitely, I do believe that things are happening, and I mean, just us having this type of discussion and listening about all the amazing work that each one of you is doing, it's just already making a huge impact. So I also do feel hopeful about what's going to happen in the future, right? But I wanted to go back to both of you, Dr. Lee and Vicky. How do you see the Aruba nursing pathway program evolving in the future? What opportunities for innovation are there to improve outcomes for students? We can start with you, Dr. Lee.
I think maybe the short answer would be that it's a model that other institutions could adopt. I think there's a benefit of having a pathway program that's integrated rather than a associate and then apply to an upper division. There's something about, and that's not to make disparate comments about upper division programs, but there's something about a four-year education that gets to the formation part, and it gives more time to develop those professional behaviors that we want to see. So I think it's a model others could adopt, and I think it also made us look internally about, are we really supporting all of our students the way we need to? And that's important for all programs to do, just to make sure that, I mean, someone mentioned the weed out courses, and that resonates with me, because I see that on end of program surveys every now and then, that, these are weed out courses. It's like, no, we don't have weed out courses. But if students believe that, we need to put supports in place so that perception goes away. So I think it's a model, and it really did force us to look internally at what we're doing and how we can be better.
Yeah, and I just want to add, to put my administrative hat on, it takes donors, right? I mean, Dr. Lee let out with the fact that we had a $4 million donor last year. Was it last year, Lee, or the year before? That gave us the ability to continue what we had started, because, as I know all of you in Arupe know, it's the program is totally run by donors and generous philanthropy. And so I think one of our missions has to be to exactly do the work you're doing now and continue to get people excited about this and willing to donate to make this work.
Thank you both again for sharing, and we'll keep an eye on how things progress and continue to innovate. This is already innovative as it is, so I'm just super excited to see what comes next. But now, Professor Alonso Johnson, I want to ask you, how do undergraduate institutions need to evolve if they want to be part of the solution to this problem?
Well, I do think that undergrad institutions should start with those supports and start, trying to dismantle this weed out these weed out classes and actually support their students. The other thing that I was thinking of too is when Dr. Marte talked about the kind of a student-led, so that, our instructors change. As instructors, we need to actually listen to what our students are saying and what they would like to see. Sometimes in our institutions where, if instructors have been there for a while, they're set in their ways of how they like to do things. But we have to also be open. If we're telling our students, we're helping you grow and learn, we have to continue growing and learning as well. And so the instructors also have to listen to the feedback, listen to how we can improve in learning more about cultural responsiveness, learning about other cultures, trying to understand our students as well so that we can actually create content and hopefully create content with them for the next group of students to continuously improve. Because I think that, I mean, when Dr. Marks was talking about the instructors, I mean, like I would bring up something from my cultural background to one of my biology instructors, and they'd just be dismissive. Oh, that's like a wives' tale or whatever they would say. But then like why not take the opportunity to actually think about what might be going on as a case study? Like you can bring it up, and sometimes just because it's not out there in the research, maybe no one has done the research on it because they've dismissed it. And maybe there is a thing about like, going, for example, going outside with your hair wet. Which is something that, my mom brings up all the time. And then later on realizing there was a study that said that like it could be lowering your immune response. And that is something that we've in our culture have known for a long time, but maybe was dismissed because there's no research on it. So being open to our students, I think is as part of the instructors is also super important to keep on changing what you're teaching and hopefully building curriculum with your students.
It sounds like we have to get all of our intersectional identities involved into this progress, right? Into this process. So it sounds incredibly exciting because to me, it's just another opportunity to continue learning and growing as a human being. And I think that's something that every one of us should be seeking to do, right? To learn and to grow. So I'm hopeful. And with that, I want to ask you, Esther, what policy solutions exist for improving workforce diversity in the health profession? Are there any successful policies that we should be paying attention to? Any proposals that we should be advocating for?
Absolutely. Thank you for that question. One thing I would like to say is just kind of like Dr. Denise said about reinventing, not having to reinvent the wheel if you don't have to. I feel like there's lots of, bills out there that talks about, financial situations from students from underrepresented communities. I think what we should be focusing on is pressing on them to actually include more so language in the bill that is directed towards actually including more funds. For example, we have loan repayment programs. Why don't we have, maybe larger grace periods for students from underrepresented communities? Because expecting a recent college graduate to pay like $80,000 back within 5 years or 10, it's not doable for certain people based on the circumstances that they live in. So just focusing more on pouring into bills that are already there and making sure that they're actually serving the directed population that they're meant to be serving is a huge importance. In terms of new things, I feel like, there are great programs to get people interested in health professions, like Arupe College, for example, which I'm forever grateful for. There should be more programs like Arupe College 2-year programs to just financially, there for students' financial support, emotional support, and social support for getting into the professions that they are interested in. Because the thing is that a lot of underrepresented students are not really exposed to programs like that or even really have access to programs like that. So just creating more access and finding ways to advertise programs like that would be really helpful to retain students and keep them, going in ways to achieve their career goals. So pretty much more support, more resource to retain students, most especially when they get into the health professions. I think that's another big thing, making sure that while you're, employing students from different backgrounds into like nurse practitioners positions, for example, making sure you have the support and resources to keep them in those positions. I feel like that's something that's not really talked about. And unfortunately, a lot of, most especially people from diverse backgrounds tend to struggle when they get into positions like these because they're not really supported.
Thank you for sharing that with us, Esther. So now we're gonna move into the round robin section of the conversation, the discussion. And I wanted to keep it simple. I know this whole subject and this whole topic is not simple, but if you could tell me either one policy, one program, or one individual action that you think would move the needle on this issue, what would that look like? What would that one thing be? We can start with you, Dr. Wilbur. And you can take a few seconds to think. Please,
Okay.
don't.
Well, I guess programmatically, I'd go back to something that was said about admissions. I know it took years for our program to decide to drop the GRE as one of the requirements. It was very difficult to convince faculty that we didn't need it. And then along with that, the pandemic ended up helping us drop the GRE. So there were some good things that came out of it. And we had a question in our admissions, an essay question around what diversity do they believe they're going to bring to our program. And anecdotally, we had heard from students that said, I chose your program because of that question, that I knew I would have a more diverse cohort to be with. So there's a lot of work that still needs to be done around our admissions process, but that was one small success.
Thank you for sharing. Anyone else? Any policy, any program or individual action or anything? An advice maybe?
Yeah, I think an individual action, kind of like I talked about, supporting students once they are out of, universities or colleges and are actually like going into their professions. I think in the process of that, it could start from high school, supporting high school students to apply to colleges and universities, supporting them with programs when they are in undergrad to be able to apply to nursing programs, certificate programs, or even, to be a medical assistant or to med school. And I feel like personally, as a first-gen student, most especially not spending a lot of my years growing up in America, I moved to the United States having no idea what I was getting myself into. And fortunately, finding a community like Arupe, and, when I later on transferred to get my bachelor's at Loyola, I was able to, have people who truly supported me and believed in me by helping me, like telling me, oh, like these are the next steps you need to take if you're interested in this program. These are the courses you should be taking if this is the, career you want to get yourself into. So I feel like, there's so many hidden curriculums and things that a lot of first generation students do not know about. And it generally puts us at a disadvantage when we're applying for higher degree programs because you don't know what you don't know. And if nobody is telling you, then how would you know? And, this does not mean like that you're not capable of attaining like such milestones, such as going to med school and becoming a doctor or a lawyer. It's just because when someone is not exposed to environments that allow them to learn about these things, they're not really able to actually get to where they need to get to. Like it might put you at a disadvantage in, being accepted into a specific program that you're interested in because some other people were just fortunate to have lawyers or doctors in your family, So I think just having that support would be really, really important and helpful to a lot of underrepresented students.
I have to run unfortunately, but I'm gonna make a plug for not ending what's the thing that's about to end? I'm so sorry, I just went blank. Affirmative action, not ending affirmative action. I think that if affirmative action is like overturned, we're going to be going in really the opposite direction that we want to go in. I think it's like the bare minimum that even puts diversity on the radar at a lot of places that like don't genuinely have the resources or time or the personnel to want to do the work. So I think anything we can do to just ensure that, you know, if this does go away, do we have like robust contingency plans to make sure that we're holistically reviewing applicants, whether that's removing standardized testing requirements, making it cheaper to apply to schools, making it easier, you know, putting in the mental health supports and social supports in high school for people to be able to successfully get through that phase of their academic journeys. I think we're fortunately maybe not going to be heading in the right direction at the end of this legislative session.
Yeah, I agree with
Thank
that.
you all for having me.
Yes, thank you. I agree with that. That's very, it's very instrumental for us to bring this discussion forward if we really pay attention to what's going on politically. The one thing that I would say is, and Carlos, you said keep it simple, so I'm going to keep it simple. It's awareness, right? Nursing 80% white. Sometimes it sits in the back of our mind and never comes forward, but this is such a multifaceted issue that if we don't keep it front and forward in our mind and make sure that every place we go, every meeting we're at, every issue that comes up, whether it be political, financial, socioeconomic, that it's forward in our mind, I think whatever we can do to enhance awareness, I think would really make a difference. So that's what I think is one of the most important.
Rose, I can keep it simpler probably. I think we have to address the funding issue because it's great to have grants I mean, we're very fortunate to have that HRSA grant, but it's going to run out. And there should be some sort of a mechanism for continuing those. Maybe it's not the same funding level, or maybe, I know this might be unpopular, but can we funnel some money from graduate medical education into other health professions? Just to make sure that we have funding available to support and sustain these programs.
Professor Alonso?
Um, I also agree with the funding. I also liked Esther's idea of making that like loan forgiveness longer or easier for people to have. Sometimes one of the things that Dr. Wilbur was talking about or that I read is that like a lot of people go into the early, you know, the lower end or lower paying professions, but usually those tend to be like faster degrees and you can start making money right away. And sometimes people can't afford to not start making the money. And so how can we help financially to make sure that they can stay in a slightly longer program? Or if they do, like they can have more years working before they actually start repaying instead of starting right away so they can build some of their wealth. So yeah, I really like Esther's idea and just thinking about the policies that we could fight for funding and for forgiveness on building our health workforce.
Well, what a great way to end this conversation. I know we went over a little bit, and I truly do appreciate your time. And I'm sure every single person that is listening or that will listen later on does the same. And we're just so excited to continue seeing the work that you all continue to do for our communities, for our country, for our students. I am super proud that I get to learn from you all and very excited to see what comes next. Again, thank you for taking the time, and thank you to the listeners for joining us and continue growing and wanting to learn and figure out ways to make this a more diverse world in general. So thank you again so much for this conversation.